Hello everybody. Today we are going to explain what the approach of the patient should be when they want an operation in Turkey. First of all, you have two options. I'm going to tell the first option. In this option, the patient has to come to Turkey just one time, but has to do some preoperative tests in their home country. What are these three tests? First of all, a blood test. We give a list of these blood tests. Secondly, a gastroscopy. It means an endoscopy of the stomach to see the inner side of your stomach. And thirdly, an ultrasonography of the abdomen, of the belly, to see the inner side of our body if the patient has a increased liver size, if there are gallstones, and to detect some other problems. When the patient collects these results, they send us by mail or other social media, and we inspect them. When we have seen and when I have spoken with the patient, we give an appointment for the operation so that the patient can arrange this appointment and can arrive to the hospital one day before surgery, to do some other tests before the surgery, the remaining tests. What are these tests? Psychiatric consultation, cardiologic consultation, dietitian, an X-ray of the chest, and the patient is directly hospitalized. The patient can also bring a companion with him or her. So you don't need to book an hotel. You are just hospitalized, and when the discharge date is arrived, he can turn back to his country by flight without any problem. So you don't need to book an hotel. In totally, the patient stays 4 nights in the hospital. He arrives one day before surgery and stays 3 nights after surgery. So totally, the patient stays 4 nights in the hospital. To give an example, Monday the patient arrives, the remaining tests are done. Tuesday is the operation, and Friday the patient can fly back to his or her home country. This is the first option. The second option is that the patient comes twice to Turkey. The first time to do all the tests in our hospital in one day. It starts at 8:30 a.m. until 4 p.m. All tests are done here in our hospital, and the patient can fly back to the home country to wait for the results that he has done. After 1 week, we explain the results and we give some instructions for the preoperative phase so that he can prepare for the operation. What is the preparation? First of all, when there is a vitamin deficit, he has to take vitamin supplements. When there is some other problem, you have to act in an appropriate way. And also, last but not least, the patient has to follow a preoperative vegetarian diet that we give to the patient. The patient then comes for the second time for the operation. Again, 1 day before surgery until 3 nights after surgery. So in the second option, the patient comes twice to Turkey. The second time, again, for 4 nights without booking an hotel. After surgery, after discharge, 6 weeks post-operative, we have a phone call with the patient where we ask some questions. So he doesn't need to come to Turkey again, but at 6 months or 12 months, we advise the patient that he comes to Turkey so that I can see and inspect the patient live. Thank you for your attention.